Age Guide Northeastern Illinois is part of the State Health Insurance Assistance Program, or SHIP, that offers free, unbiased counseling for Medicare and Medicaid beneficiaries. Age Guide and its partner agencies have SHIP counselors ready to help you navigate these complex programs and ensure that you and your loved ones have the health coverage that works best. We're going to focus on how Medicare Advantage plans work and how they compare to original Medicare. Medicare Advantage plans are an alternative to original Medicare. Advantage plans are offered by private insurance companies, and they include your Medicare Part A hospital coverage, Part B medical insurance, and usually your prescription drug coverage. Medicare Advantage plans can also include benefits that original Medicare usually doesn't cover, such as dental, hearing, and vision coverage. When it comes to how you get your Medicare services, you can choose between original Medicare or a Medicare Advantage plan. You can choose between different types of Medicare Advantage plans, including health maintenance organization plans, preferred provider organization plans, private fee-for-service plans, and special needs plans. Other less common types of Advantage plans include HMO point-of-service plans and Medicare Medical Savings Account plans. A health maintenance organization, or HMO, is a type of plan where you must use an approved network of providers. You must choose a primary care physician, and this doctor will provide your medical services or refer you to a specialist. Referrals are required in order for you to see a specialist, otherwise the plan will not cover you. Although an HMO plan can be restrictive about the providers you see, these plans generally cost less than other plans. HMOs have an in-network out-of-pocket maximum, which caps your medical expenses. Once you reach your out-of-pocket maximum, the plan will pay 100% of your medical costs. But this does not include the cost of prescription drugs. A PPO gives you a choice of using in-network providers and gives you the option to see providers that are out-of-network and accept Medicare. Although you have the option to see out-of-network providers, you will pay more compared to in-network providers. PPOs will have an in-network, out-of-pocket maximum, and one for your out-of-network costs. These out-of-pocket maximums vary by plan, and usually the out-of-network maximum is higher. PPO networks can either be local, cover one or multiple counties, or a regional network that can span multiple states. PPOs generally cost more compared to HMO plans. A private fee-for-service plan decides how much you pay for doctor and hospital visits. A plan member can receive services from any Medicare-approved doctor or hospital that is willing to accept the plan's terms and conditions. The plan may require you to see in-network providers, or they may not cover you, but the plan is required to cover emergency or urgently needed care. While most Medicare Advantage plans include drug coverage, you can purchase a separate Part D drug plan if your private fee-for-service plan doesn't cover drugs. Special needs plans are limited to people with specific diseases or characteristics. A Medicare special needs plan is designed to provide focused care to the enrollee's conditions. All special needs plans must provide prescription drug coverage. Medicare is a complex system of moving parts, but for a Medicare beneficiary, it can all boil down to how much will this cost me. What you pay when you go to the doctor is different whether you're covered by original Medicare or a Medicare Advantage plan. And most importantly, what you pay in a year can be very different depending on how you choose to be covered under Medicare. Let's go over what you pay with Original Medicare. Medicare Part A is free for most people when you have 10 years of work history. You can also qualify for free Part A through a spouse's work history. Otherwise, you will have to pay a monthly premium for Part A. If you do have to pay, but have low income, you may be able to get Part A for free through a Medicare savings program. Medicare Part A has a deductible that's paid for each benefit period, and you could have to pay it more than once in a year, depending on how often you are hospitalized. Medicare Part B has a base monthly premium, and low-income individuals may not have to pay this premium if you qualify for a Medicare savings program. Higher income households may have to pay more than the base monthly premium. You pay a once-a-year deductible with Part B, and you can be penalized if you do not sign up for Part B. Medicare prescription drug plans, also called Part D plans, are separate insurance policies that are required to cover your drugs. You can be penalized if you don't sign up for a Part D plan, so you should consider signing up even if you don't take any prescription drugs. Low-income households can qualify for discounts on Part D premiums and copays with the Extra Help LIS program through Social Security. Part D plans can have a yearly deductible, but some drugs are exempt from the deductible, so you will pay the discounted rate without paying the deductible. Medicare supplemental plans, or Medigap plans, are optional plans that cover costs that you would normally pay out of pocket. These plans cover costs such as Medicare deductibles and copays. Medigap plans are standardized by Medicare, so one type of Medigap plan will cover the same costs no matter which insurance company you choose. Plan prices vary widely depending on the plan you choose and the insurance company selling the plan. When you sign up for Medicare Part B for the first time, you will have guaranteed issue rights for 6 months to choose any Medigap plan without consideration of pre-existing conditions, and you cannot be denied a plan. Outside of this 6-month period, you can sign up for a Medigap plan at any time, but you could pay more for the plan, or the insurance company can refuse to cover you. When you enroll in a Medicare Advantage plan, you are still required to pay for the Medicare Part B premium. Some Advantage plans have a $0 monthly premium, and others can charge an extra amount on top of the Part B premium. Most Medicare Advantage plans include prescription drug coverage. Advantage plans can have deductibles for health care and another for drugs. For certain health services, you will have to meet the health deductible before the plan pays for services. The plan may charge copays or coinsurance for certain doctor visits or procedures without needing to meet the deductible. A copay is a set amount that you pay out of pocket, and coinsurance is a percentage that you pay that is set by the plan. Advantage plans have set out-of-pocket limits that cap your yearly expenses. Once you meet your plan's out-of-pocket maximum, the plan will pay 100% of the costs. You will want to confirm that your healthcare providers are in your plan's network to ensure you're paying the lowest cost. Going to out-of-network providers will mean that either your plan charges you more or they can refuse to cover you. Your Advantage plan can also offer extra benefits such as dental, vision, and hearing coverage. These services will also have copays and require that you go to approved providers. Now, it's important to know how your two coverage options are structured: Original Medicare and Medicare Advantage. When you have Original Medicare, you are covered by Part A and Part B, and separate Part D and Medigap plans. Part D and Medigap plans are optional, but remember that you can be penalized if you are not covered by a Part D plan. You may have up to 3 different insurance cards, one for Medicare, another for Part D, and lastly one for your Medigap plan. So remember to use all 3 cards when you see your doctor. You usually only need to take these with you when you're seeing a provider for the first time. Otherwise, it's safer to store your cards securely at home. With Medicare Advantage, you would have one insurance card that includes your Medicare benefits, prescription drug coverage, and any extra benefits offered by your plan. When comparing Medicare Advantage plans, one of the most common questions is, which one is better? SHIP counselors can't choose a plan for you, but you can pick the type of coverage that will save you the most money. One way that you can compare the costs between Original Medicare and Medicare Advantage is to consider the maximum amounts that you could pay in 1 year for medical services. Medicare Advantage plans have out-of-pocket maximums that cap your expenses, and Original Medicare does not have a limit unless you pay for a Medigap plan. Let's compare what you could pay in 1 year with a Medicare Advantage plan and Original Medicare with a Medigap plan. One of the most popular types of Medigap policies can cost about $1,700 a year. This plan will cover most of your out-of-pocket costs when going to the doctor or if you're hospitalized, which means the most you will pay in 1 year for your medical care is a little over $1,700 a year when enrolled in Original Medicare and this Medigap policy. Now, this particular Medicare Advantage plan has an out-of-pocket limit of $2,600 for a year, so once you reach this limit, the plan will pay 100% of your medical costs. With these two numbers in mind, $1,700 and $2,600, consider how much health care you need in a year. How often you see your doctors, or if you have a procedure you need to schedule, will tell you how much you could have to spend in 1 year. How much health care you need in a year can tell you which type of plan works better for you. If your healthcare will cost more than $1,700 in a year, you can see that a Medigap plan will save you a few $100s compared to the Medicare Advantage plan. On the other hand, if you need less than $1,700 a year in healthcare, the Advantage plan without the Medigap monthly premiums may save you more. This is just one example, and your healthcare needs are unique, but a SHIP counselor can help you find the type of plan that works best for you. Here at Age Guide, we have Senior Health Insurance Program Counselors, or SHIP counselors, who can help you navigate your health insurance options through Medicare and help you find ways to save on Medicare costs. The Senior Health Insurance Program is a free statewide health insurance counseling service for Medicare beneficiaries and their caregivers. You can contact Age Guide at 800-528-2000 to speak with a SHIP counselor or contact one of our Aging and Disability Resource Network partners for local assistance.